All right, everyone. So we're going to get started. My name is Red Quenda. I'm the events coordinator for Family Education and Connection with New Student and Family Programs. And today we are going to have a health and well-being webinar. So our first presenters are going to be Sharon and Fernando, who are going to be presenting from health and well-being. So I'm going to turn it over to Sharon. Sharon, are you able to share your screen?
Yeah, it says that the host has disabled participant screen sharing.
Okay, there we go.
Okay, are you guys able to see my screen now? Let's see. Hopefully people can see my screen now.
What do you want to do?
Yeah, Sharon, we can see it.
Okay, thank you. There are still people that are needing to be admitted, so I'm kind of toggling back and forth to that. I don't know if that can be changed. Okay, so sorry for my inability with these this venue, but we'll keep going here. My name is Sharon Young, and I'm the director of the Student Health Clinic, and I'm here with Dr. Fernando Ortiz, and he is our director of psychological services. Together, we work in unison in the clinic for health and counseling services. And I have a few slides to share with you. We are a department within Student Affairs. Our mission, quite simply, is to support and improve the health of students. We're basically here to get them back to class and back to enjoying their activities at the university and enjoying student life, participating in class. We serve campus-based students, so that would be our undergraduate students and transfer students, as well as graduate students that are present here, law school and University of Washington School of Medicine students. And we're an integrated clinic. So we serve students from both the medical, for both medical and behavioral health needs. And it's wonderful to be together in the same building. So if a student finds that they have issues on both the medical and wellness, mental health side of their needs, then we can collaborate together to provide them the best care possible. This slide just shows you a picture of our waiting room. I'm hoping that you can see from this that we're very typical to a standard medical office. We have nice private spaces with our reception staff, so students can come in and share their concerns in as confidential a space as possible to get their appointments scheduled. And our office hours are over on the side, where we are here from 8 to 4:30, Monday through Friday, with the exception of Thursday mornings, where we open just a little bit later so that we can have our necessary staff meetings. After hours and on the weekend in our Spokane community, there are several urgent cares and local emergency departments that students could go to if they needed to. And we also offer an Uber health ride, which is an Uber that is able to get you quickly to urgent care or ER. And in the evening and on the weekend, our security department helps students coordinate that. Our location on this map is we're up along Sharp Avenue next to Dakota Street, just a little bit west of the roundabout. And here's a picture of our location. So we have a pretty humble little one-story building with the medical side of our clinic on the main floor and our counselors on the lower level. Our staff for the medical side of the clinic consists of providers, a family practice physician and nurse practitioner, registered nurses, and a medical assistant, as well as our administrative staff, and then our whole counseling department, which is our psychologists, counselors, residents, interns, and then we have psychiatric services for the sake of medication management, and also the residents are able to assist in that area as well. On the medical side of our clinic, we see students for acute and chronic illnesses, minor and major procedures, minor injuries and minor procedures, physical exams, health screenings, triage visits, immunizations, still some COVID testing, and we do have that available, as well as our providers able to assess with the student what their upper respiratory issue might be, whether it's COVID or another type of respiratory illness. And then we can order and process lab work and also send students to local providers for x-ray. So our provider here would order the x-ray, and then students would be transported via their choice, whether they went with an Uber Health ride or they drove themselves or a friend drove them to get x-rays. Our providers also refer to specialists as well. If you remember, our clinic on the outside looks pretty humble, but when you come in, you're going to find that our clinic exam rooms are very consistent with what you might see in your hometown at your doctor's office. They're very clean, private, confidential setting where a student can come in and have a private consultation with the provider and get their needs addressed. Prescription medications and refills is a situation where we have a couple options. So there's several over-the-counter prescription medicines that our providers can prescribe and provide to students in our pharmacy, or they can choose to have those prescriptions sent to a retail pharmacy. Students are given the option to purchase them, purchase medications at their pharmacy so they can use their insurance. Like Safeway is just a couple blocks from campus, and there are other retail pharmacies that are relatively close, or they may decide to get medications through our clinic. The medical providers also can refer to specialists in the community. So if a student comes to campus and they have a chronic ailment that they believe is stable and doing fine, but then maybe things change and they need to see a specialist, the providers here is an excellent place to start. So they can refer that student to a specialist, and then we can work to help them get in with the specialist. And a student is an active participant in that process. So figuring out who might accept their insurance, figuring out who they might be able to see, and then them coordinating an appointment that works with their schedule. And again, health ride transportation is available for those kind of things for students that don't have transportation. Our counseling department is what Dr. Ortiz will speak with you about.
And students access our services for various reasons. We listed some of them here. And actually, in the last few years, anxiety and depression are the two most commonly reported reasons why students access our services. And again, I wanted to emphasize our services are confidential. We don't release any information to anyone unless we have the authorization from the student. But we included some other reasons why they access our services. Could be grief and loss, if they have experienced a traumatic experience, obviously adjustment struggles, coming to campus, being away from family. So that includes feeling homesick, or if they feel isolated in any way. Any type of relationship struggle, we will be able to listen to them with a lot of empathy, try to make a connection with them, to be there for them. Often they have struggles maybe with roommates or anyone else. So we really try to be there with a lot of compassion for our students. And related to the anxiety is obviously stress. Students are coping with a lot of academic stressors, among other things. And we are able to provide strategies to be able to help them manage some of those, very stressful experiences. And then every day, Monday through Friday, during the day, there is a counselor here who's available for any student who needs to walk in if they're experiencing a crisis. So that means they don't have to set up an appointment and wait for several days if they're experiencing a crisis that very same day. That service is really helpful to students. Sometimes they literally walk over here straight from a class, or if they had something that was very stressful to them, and we're able to listen and see them on the same day. And then with all of these services, especially with depression, we are constantly, continuously assessing for suicidality. And that's very much a standard of practice in psychotherapy and psychological services. We will be asking students whether there is any suicidal ideation, any plans to harm themselves. We monitor that very, very closely. And related to the crisis, by the way, every time that someone walks in here, we are going to listen to the student and evaluate whether there is any tendency to self-harm in any way. So we try to really care for the students when there is suicidality, depression, or any type of psychological risk. And as Sharon was alluding to, we work in a very integrated way. What does that mean? Sometimes they'll see a physician, a doctor, for something that is medical, health related, but in the process, the doctor is going to listen, let's say, for any depressive symptom, and then make the connection with us, make the referral to us, or vice versa. If we're listening to the student about something that is psychological, we can make a referral to health-related services, and also for a medication evaluation. As you probably know, in the case of some of these psychological struggles, having a medication evaluation can be very helpful. Let's say a student hasn't slept for 3 days, there's loss of appetite, there is something that is affecting their health in any way, along with the mental or psychological struggle. We will make sure that there is a referral to some psychiatric evaluation, some medication, and then we will coordinate the care, very much consistent with our mission that we are here to provide holistic care that looks at every single dimension of our students: medical and health, psychological and counseling, psychiatric, and so forth. So in a very integrated way. And we can take a look at the next slide that has a little bit more specifics in terms of our counseling model. So picture this: a student comes in here, it's February, they're feeling overwhelmed, there's a lot of anxiety, they're not able to focus, they're struggling, or sometime at the end of April. We will make sure that we focus on solutions. What is it that is going to help the student see outcomes right away, being able to go back to class, to focus, to manage whatever symptoms they're struggling with. And so we say our counseling model is going to focus on outcomes, alleviating some of those symptoms, and we always try to structure. Okay, we got a month. Let's get moving on this so that we can attain some of those outcomes that the student needs, and we work collaboratively with the students. Some of these students might be seniors and they only have a few weeks to go on with their lives, or maybe they're going to go and study abroad. And so we try to establish that action plan with the students to focus on outcomes. And by the way, if there is a need for something that is more specialized, like an eating disorder or something that requires specialized care in the community, we will facilitate that with the students. In other words, we'll talk to those specialists, we'll get the consents and the documentation, we will collaborate with whoever needs to also be added to that care. And again, no cost for these psychological services, and it's confidential, it's private. If there is a need for any disclosure any, for the referral or any collaboration with anyone outside of the counseling team here, we will make sure that we talk to the student and we get those forms. That's, again, a standard of practice with any psychological service for the management of health records, of psychological information. Let me take a look at it looks like we don't have any questions. Thank you, Sharon. We do get waivers sometimes, again, to be able to collaborate with other professionals, including campus partners, for example.
In this case of psychiatric medication management visits, it can be complex. So a student may come here and initiate school at Gonzaga with some history of utilizing antidepressants, Ritalin, Adderall, anti-anxiety medications. And those students may opt to transfer their needs for follow-up visits and refills to the psychiatric provider here. And there may be students that have new needs that emerge as they are here, and we work to address those students. Students that are from state of Washington may consider keeping their provider back home and utilizing a virtual visit. That can be convenient because this provider may really know them, know their history. And within the state of Washington, this can work well, especially if there's considerations about controlled substances. If a student currently takes these medications, it would be wise when they come to campus to have plenty of medications on hand so that we can work to get them into a schedule to see a provider here, or they can work to transition to a virtual visit with their provider back home, or make those kind of decisions. So my best advice would be to make sure that they're not just a few days from running out of their medications. If students want to see a psychiatric provider here to consider starting medications, then oftentimes we'll encourage them to start with counseling and work with a counselor, and also then along with that, see the psychiatric provider. We refer to community providers as needed to meet students' needs. So if we have a student who has complex needs, or their needs are going to extend beyond their time in the university, it may be that their needs are better met with a community provider, and we would work through that with the student. There can be nuances to psychiatric medications, and we encourage you to call the student in health clinic for more detailed information about a student's individual situation. Costs at the health and counseling clinic. So payments are due at time of service, and students can pay with their student account, Bulldog Bucks, or debit credit card. Visits are very reasonable. We do not process insurance in the clinic. They do get an electronic walkout statement that has coding, so that could be submitted to your insurance company. And external care does get processed by insurance. So if they had lab work, it's sent to the lab core and they would need their insurance. Or if they had x-rays at Inland Imaging, then they would need their insurance for that processing. And again, there's no cost for counseling, and seeing a registered nurse for consultation is also a free service. A little bit about HIPAA and FERPA. So we have to deal with regulations of confidentiality, and we maintain students' confidentiality. In our world, we follow HIPAA regulations about student information. Students can decide to share with their parents what they would like, and we would ask that they sign a consent for each individual situation. We are happy to speak to parents about how we care for students and what we do, but to talk about your specific student and what's going on, then we need their consent. COVID-19 is still in our world. We do offer testing here. Like I talked about, our providers can help students sort that out and also provide guidance about where they might be able to get vaccines in our community. And I'll turn this one over to Dr. Ortiz to talk a little bit more about other options for emotional well-being.
We have also added this service, Student Link, and we included some of the descriptions of some of the descriptions on the service. And basically, any student who's actively enrolled at GU is able to call after hours, after our office closes here and on weekends. And they have up to 5 free sessions with the counselor. They're able to set up an appointment or talk to the counselor right away for any type of psychological need, and they get the coaching and the listening and the strategizing, whatever they may need for that need at that time. And we also have access to a regional crisis line, and this is especially the case for any student who has depression or maybe a history of suicidality. If the student were to come in here today, for example, we will provide them with these numbers so that they're able to talk to someone after hours or on weekends, and they're able to talk to a licensed mental health provider.
The Health and Counseling Clinic also has an online health portal, and just a few comments here about what the health portal can be utilized for. It's an excellent tool to communicate with the clinic with, kind of consistent with something you might be exposed to called MyChart. I know that Providence has, I believe Multicare has as well. And right now, the students that are incoming for the fall have lots of things that they need to be submitting, like their vaccine requirements and forms. If you have questions about these things, please call the clinic. And that concludes our section. We are just so grateful to be here to help support students. What I've found in health and counseling is that we have some very experienced clinicians who are dedicated to the care of students. Everybody comes from a little bit different experience out in the community prior to coming to college health, and together we are just able to really exceed my expectations for just an excellent clinic to support students so that they can have a great experience here. Thank you for your time.
Thank you.
All right, I believe that I am going to be up next. Red, thumbs up. Cool. So I'm going to go ahead and share my screen here. And I think that there are a couple of lingering questions for Sharon and Fernando in the chat. All right, so wait, present mode. Hello, everyone. My name is Anastasia Lee. I go by Stacia. I am the Assistant Director for Health and Wellness Promotion at Gonzaga University, working in our Office of Health Promotion very closely with all of the other resources that are being talked about today during this webinar. Happy to talk about any of them after this meeting with all of you too. My office exists as the university's public health office on campus. So our mission is to foster student well-being through proactive, non-judgmental, and inclusive public health principles and practices. Really taking in a public health approach, knowing that health and wellness goes far beyond just academic success, and we want to make Gonzaga a place where culture of care is integrated into their student experience here. One of the biggest ways that we see that is in our Zags Help Zags program, which is our active bystander training that we provide on campus, and a lot of education goes out around Zags Help Zags. Some of our students will come to campus thinking that it is holding a door open for an uncomfortably long amount of time for someone to run at the open door. But it's really to encourage our students to act when they see an instance of harm on campus. That could be someone who's struggling with their mental and emotional well-being. That could be someone who is in an unhealthy relationship. That could be just someone who's struggling with classes and needs some resource connection or someone to talk to. We know that this is their first foray into being an adult, and they're going to be away from their families. And so, like I said, we're trying to create that culture of care on campus for our students. And we know that they're not going to be doing this alone. So in that realm of a public health guiding model that we use on campus, we use our socio-ecological model, knowing that our students are not going to be existing in a bubble alone. They have many levels of interaction with our campus, with our community, with stressors that they might be feeling at home, how it's going to be impacting their health on a daily basis. So you have all of your individual attitudes, beliefs, knowledges and skills that could be affecting them. They're going to be living in and amongst community 24/7 for the first couple of years that they're here at Gonzaga. So in that interpersonal realm, how can we empower them to reach out to build out support systems that are going to be beneficial to them while they're here at Gonzaga? Institutional things at Gonzaga that might be new to them, right? Living in a university is going to be a first for all of your students who are coming to us. So we work with them to educate them on things at Gonzaga that are going to be useful for them to know. Like the resource promotion that we're doing here, we're going to continue that through our summer orientation sessions so that they have a really good grasp and understanding of who they can reach out to if they're struggling, what those resources are going to look like, what that process looks like, try to dismantle how stressful it can seem to go into a new place and not know where everything is immediately. Knowing that they're going to be living in our Spokane community. And then from a greater society standpoint, they're going to be coming to us with stressors that they might be feeling back at home, things that they might be feeling on a global level. And so how we can help mitigate that for some of them to make sure that we're giving them access to the resources that are going to be most beneficial. In my office specifically, we use a data-informed approach to understand what are the 3 biggest topics that are affecting our students. And there's the intersections between all of these, right? So the biggest 3 that have always informed our work is relationships, sexual health and violence prevention, alcohol, cannabis, and other drug use, mental and emotional well-being, and suicide prevention. I, for the last couple of years, have focused mostly on mental and emotional well-being and suicide prevention, but we know, again, that all of these work hand in hand with each other. So you might see coping strategies for your mental and emotional well-being through relationships that you pursue or through coping mechanisms through substance use. And so my office will really work to give them healthy information or behavior change kinds of steps so that they can approach their college experience knowing that there are going to be these influences, right, that they're going to experience during their college career. But how can they have an empowered voice to pick what's going to be the best path for them going forward? We want health and wellness to follow them long after they've left Gonzaga so that they really take these behaviors with them after they've left and so that they can take care of themselves post-college. And we use SAMS's 8 dimensions of well-being to give them that holistic sense of wellness. We know, again, that there's more than just their student hat that they're going to be in. And that while that is their career, that is where they're going to be at most of the days, there are all of these other dimensions to their wellness that are part of their identity that intersect with each other to impact how they're feeling on a daily basis. So we will put out a lot of education and programming around how to proactively take care of all of these dimensions of wellness. When one of them is feeling a little bit lower, how can you balance that out by either refilling that cup or reaching out to one of these other dimensions to kind of bolster the overall sense of well-being? And teaching them that balance, right? So we know that a lot of our students experience burnout. A lot of our students are very high achieving. They say yes to everything. And so trying to empower them to say, it's okay to say no to some of these things. You don't have to commit 100% into your social life, because if you're 100% in on social, you might start to be running low on some of these other dimensions of your well-being. The ways that we will interact with the student body is a lot through presentations like this. So we are happy to step into classroom spaces, programming with the RAs that are in the dorms. We'll go into classroom settings and work with specific clubs. We put out proactive messaging around campus, provide a lot of resource marketing so students know that they exist and work to destigmatize accessing those resources. So in the realm of help-seeking behavior, we know that it can be really hard to ask for help and to admit that you might be struggling with something. And so we work to break down those stigmas so that it's accessible for people. To say it's okay to go see a tutor, it's okay to ask for help in your class, it's okay to go see a counselor on campus. We know that there's a lot of stigma that can exist around seeking help for mental health. And as I'm sure Dr. Ortiz will attest to, all of us have mental health, and we should all be talking to someone about it. So you'll see us in all of these different areas. We also provide student employment through the year. So if you have someone who's interested in holistic health and well-being, public health practices, we're happy to work with your student to get them into this field that I personally am very passionate about. Other areas, so these were some of our student employees from last year. We love visual displays. That's some of the areas that you'll see. Our programming is in the main student center. We have a health hut that promotes a lot of topics that are data informed that we know our students want to learn more about. We push out an annual well-being and flourishing survey every single year to understand what the needs are of our students as they're coming to us. So if you have specific concerns that you want more programming about or want a webinar about, I'll have my contact information at the end of this presentation, and you can reach out to me directly with things that you think your student would want to get involved in. Like I said, we do a lot around destigmatizing different topics around health and wellness, so that facts and myths, what things actually exist on a college campus, what things are just myths, or what are some facts and myths around sexual health, or facts and myths around mental health. Yeah. One of our biggest resources that I would love all of our students to be aware of is Our House. So this is our collegiate recovery community, and it's a physical house where if a student has any relationship with someone who's going through a history of substance use and wants a healthier relationship with harm reduction techniques, we highly encourage them to visit the CRC. So this could be harm reduction in the sense of technology addiction. It could be eating disorder, like treatment for that and providing a support group in that recovery process. It could be any substance use, alcohol. We've also had people there who have had really severe mental health histories that they just need a community to exist in that's supportive, where they can go and talk to a licensed counselor who is the primary contact for them. And then there's also graduate counseling students who make up the staff of this community. Here's a little bit more information on Our House. And if you need the information on drop-in hours, you can just go to gonzaga.edu/CRC. I will see if I can drop the slides into the chat so all of you have access to this after the presentation. We also curate a whole host of online resources because we know that sometimes students don't want to come to the programming on campus. They would rather access things on their phone, or they would rather access things online, and that's totally fine, especially in the COVID times when everything was online. So we encourage everyone to visit the Wellness Toolbox, where we have found a niche set of topics. I shouldn't say niche there, they affect all of us, but around anxiety, depression, sleep, relationships, and ways that they can either do their own assessments online to see how they're doing, resources of like TED Talks or YouTube videos or other websites that have been really beneficial to our student body. So if they just want to go peruse some of these topics that they have already had a struggle with, or they're a little bit concerned about before they come to Gonzaga, please refer them to the Wellness Toolbox. And as Fernando already mentioned, Student Link is one of our newest additions into the resources, and it's amazing. 24/7 support for any of our students. They don't have to be in crisis either. They could just be having concerns about different topics. And they get so much online support for finances, legal, mental health. They have assessments on their website also that our students can access. So I encourage all of you to scan this QR code. Like I said, I will share these slides in the chat after I'm done. Our students will be able to go to Mindfulness Mondays to kind of promote some sense of meditation through what is going to be a stressful first year, to just kind of give them some grounding. So it's something that our office does for our student body and for our staff and faculty. A nice way to disconnect from their, like I said, 24/7 student hat that's going to be on. And those will be advertised in our morning mail, which is the daily mailer that goes out to all of our students. If anyone needs to request a program or wants to talk to me more, they can go to gonzaga.edu/OHP. And I am happy to chat with anyone. I've met with lots of students about programs that they're interested in, things that they might be working on in their classrooms, careers that they might be interested in pursuing later on. So happy to talk to anyone there. And this is my contact information through the office. So if you ever need to get a hold of me, you can reach me at ohp@gonzaga.edu.
I believe I'm up next. All right. All right. Hello, everyone. Good afternoon. I realize you're all getting quite a bit of information thrown at you at once. So I'll try and keep my points brief, if you will. I want to talk a little bit about, so we are generally not the fun group that people want to see or talk to, but we do have many services for our student body. And one thing that I would like to touch on today is about conflict and student well-being. I want to just set some expectations by saying that today's presentation is just a bird's eye view of some of the work we do. It is not exhaustive or complete by any means. I think I actually failed to introduce myself. My name is Melkan Araya Tasfaye. I'm one of the assistant directors at the Resolution Center. After the presentation, I'll do my best to reserve some time in the end if you have any questions, but I also encourage you all, if you have any questions in relationship to conduct or conflict resolution, to reach out to me or to our office. Again, the focus of this presentation is just going to be about conflict and how it relates to student well-being. So in general, what we do at the Resolution Center, we are the office primarily responsible for the reconciliation of incidents of student conflict and conduct. We are also tasked with balancing the needs of the individual and the needs of the community. I'm here to share with you a little bit about what we do specifically about conflict resolution services and conflict as it relates to well-being. Like I said, at the Resolution Center, we understand conflict is part of the day-to-day life. Conflict doesn't happen in silos, and it's usually connected with some unmet need, whether it's physical safety need, social need, or any other need. And we also have the mindset that conflict is really an opportunity. We use a restorative approach when we address conflict. And what I mean by restorative approach is just a proactive way of working with people that focuses on repairing harm rather than just punishing behavior. So restorative approach really allows us to focus on building communities and repairing harm. And we also, restorative practices also gives us the tools to get beneath the surface level conflict, sort of understanding the why. This allows us to honor the feelings while dealing with behaviors that might not be meeting expectation. It's also about, valuing and investing in the individual and their place within the community. It's also about recognizing that we are as strong as our weakest link. So we understand conflict is a huge sort of stress and anxiety, not just for students, but for everyone. And so trying to get beneath the surface level and address it. So we have several pathways that or processes that we follow in the Resolution Center. I'm really not going to be addressing the conduct side, which is our formal process when we receive incident reports. I'm really, for today, just going to focus on conflict resolution services, which is sort of our proactive side. But in all our processes, whether conduct or conflict resolution, we really focus on the restorative approach. Like I said, each pathway provides students the opportunity to take ownership or learn taking ownership of their actions and engage in ethical discernment. We also strive to ensure that the processes are educational and future focused. So looking beyond the here and now, making sure that we're providing the students with the tools and the skills they need, whether it's communication or decision-making skills, so that they do not find themselves in similar situations, but also have the tools to deal with conflict proactively moving forward from whatever situation they find themselves in. So how do we support student well-being? We know unresolved conflict is a source of stress for students and can derail a student from their academic goals. It gets in the way of learning and growing that can take place from being part of a diverse community like Gonzaga. So here at the Resolution Center, we support students through conflict in various ways. And one of those is providing conflict resolution services. This can be proactive or reactive and allows students to resolve conflict in peaceful ways. We also do this by providing educational outcomes, which are focused on providing students with opportunities to enhance their communication skills or boundary setting skills, so that if they're faced with similar situations, they have the tools to resolve conflict before it becomes a huge issue. We also provide students with trainings and workshops and presentations to engage students so that they can acquire and enhance their conflict resolution skills. Again, whether it's, conflict coaching or other skills that might be worthwhile, not just while they're here as students at right now at Gonzaga, but in the future as well. So again, our conflict resolution services stems from the understanding that conflict can affect the social, emotional, physical, and intellectual well-being of a student. So our conflict resolution services are aimed towards empowering students. And this can be, like I said, whether, one-on-one conflict coaching or in groups through mediation to deal with conflict. We try to equip them with problem-solving skills, again, communication skills, boundary setting skills, perspective taking, all of these tools in a toolbox that can help them navigate difficult situations or have difficult conversations towards a better resolution. And so that they can also better understand and address underlying needs and interests that might be unmet. So our objectives with our conflict resolution services is really realizing that conflict is an opportunity to learn, explore, and grow. We would like to empower students to resolve their conflict constructively before it becomes destructive. Help students gain understanding of themselves and the people around them. Expand their conflict resolution toolbox so they can deal with situations as they arise and take steps instead of avoiding conflict, which really doesn't work. And also equipping them so that it increases their leadership potential and by enhancing, again, their communication or decision-making skills or problem-solving skills. Which ultimately the aim is, of course, to improve our campus climate by reducing number of conflicts. And this can be, anywhere from roommate conflict to other bigger issues as well. So how can students access our conflict resolution services? Students can access it by, submitting an online request form or by contacting us in person or over the phone. And once a student submits a form or requests a conflict request conflict resolution services. We can schedule a meeting with a conflict consultant who can talk to the student to try and better understand what the conflict is about. And then with the student, work out what would be the best avenue or the best way to resolve the dispute. So there's no one size fits all. We try and work with students to try and figure out what would be in their best interest or what would empower them to resolve this conflict. And then try and help them follow through with whatever path they choose. So that is it for me. If there are any questions, I'm happy to take them.
I have got one more surprise presentation for you all, because one of our resources that is an integral part of our Wellbeing and Flourishing pillar at Gonzaga was not able to be present for today's webinar. So bear with me. I'm going to be sharing the slides for our Center for Cura Personalis, and then we will take questions from all of you afterwards. Please keep in mind, you can still drop any questions into the chat while I go through these few slides, and we will be happy to answer those in the meantime. So our Center for Cura Personalis stands for care for the whole person, kind of like what I had talked about in my presentation, also of wanting to make sure that we have that holistic sense of health. And so we talk about this center in the sense that they're kind of like our case managers or resource brokers on campus. Very much a social work kind of realm to this, but really understanding that when our students think it's going to be a straight line from A to B, very rarely is it going to be that way. So our students go through this whole journey of growth while they're with us at Gonzaga. And at various points, they're going to need case management for any instances of concern. This could be before crisis, right? But our case managers will also deal with students in crisis and work directly with our health and counseling services to make sure that they're getting the most appropriate responsive help as needed. They also work with consultation, collaboration. They also go out into our Gonzaga community for presentations. They work on that relational building with our students to make sure that they have the support they need in the instances that they need it. They have a lot of one-on-one meetings with our students to really follow up and make sure, hey, did that resource actually work well for you? Is there something else that we should try? And they're really tuned into the things that Sharon has already talked about for what's on campus, what's in our community, what's online, and get them into an area where they're going to feel the most supported. So let's see here. Things that they help with often: mental health concerns, body image and disordered eating, interpersonal conflicts, physical illness and injury, losses in your family or close friendships, and sexual and physical assaults. They work really closely with our housing and residence life department on campus, with Title IX, with health and counseling services, to make sure that they're aware of different incidents on campus, and they can directly connect with those students as soon as they hear about something. So it's a great place to start, and that's what they will say also. Great place to start if your student doesn't know where to go. I will be the first to admit, Gonzaga has what we call an alphabet soup of departments. It can be really confusing to know which department does what, who's going to be the best person to talk to. And if that's ever the case, I always recommend starting with the Center for Cura Personalis. It's also a very easy refer form to fill out, and a parent can do that for their child also. They are not confidential, they are private. So that means that they can share with respective parties on campus, like Dr. Ortiz, like Sharon, like myself, like Malcolm, if it's a student who really needs some higher level resources that they're not going to be necessarily equipped to handle with licensing or anything like that. A lot of our students will self-refer to go meet with one of our case managers on campus. So if your student is self-driven and wants to fill out their own form for themselves, they can do that. Some of the misconceptions: They are not going to be counselors. They are not part of conduct, but they work with conduct. Meetings are not going to be mandatory if your student chooses to reach out to them. And they cannot excuse students from class, as much as our students may want that. But they will work to be flexible with your student to see if they need to meet in person or online. They can do either. A lot of times they'll go to a walking meeting around campus because that's really accessible, and we have some really nice weather in Spokane, which is fun to be out in. And they can easily refer to any of these areas on campus that your student might need. So if they need to meet with one of our counselors, they are happy to do a warm handoff, walk them over to Dr. Ortiz or our number of counselors, and make sure that they are just left in a waiting room. And if you need to refer someone, it's just gonzaga.edu/refer. Can't get easier than that. I will make sure that these slides are also in the chat as we go into our Q&A. So you can reach out to them also.
Thank you, Stacia. So for the benefit of the larger group, I'm going to read out some questions for the Q&A. A lot of these questions have already been answered, but as I'm reading out these questions, feel free to add more into the chat. So first, we have some questions surrounding waivers and forms, in particular for connecting professionals with parents. So what does that process look like? And is that process different if the student is under 18?
So I think I could take that question. And I'm a little bit unclear. Red, did you want me to respond to it in the chat, or did you want me to respond to it verbally?
You can respond to it verbally, just for the larger group.
Okay. So in Health and Counseling Services, we have a release of information document that students can complete to have information shared with their parents. And it's not a blanket document that goes for the entirety of their relationship with health and counseling. It would be situational. So a good example would be if a student had a complex issue with a knee injury and the parent is helping collaborate and work on the specialty care for that knee injury, then the student can fill out a release of information, and then our providers are excellent about talking to the student and the parent and coordinating the referral and what needs to be done from our end so that the student can take that injury, get that injury taken care of. So the student is the one that initiates the release of information to parents. In the case of a student that's under 18, then in their student health portal, there's a document that they have their parents sign so that they can be treated as an adult in the clinic. So in that situation, then the parent would sign that form and it's submitted in the health portal. When a student comes in to receive care, we make sure we have that form so that we can care for them. And then release of information would be the same. It would be driven by the student.
Thank you. If a student has an existing prescription, are they able to get them filled on campus?
So existing prescriptions are sometimes chronic medications, and those are better filled at a retail pharmacy. We have a small pharmacy in the clinic, but it's more for medications that are needed on an acute basis. And it's actually the medications that are the most affordable. So it might be amoxicillin or a Z-Pak or something for nausea. So it's about those acute issues. If a student needed an antibiotic that was more expensive, we don't carry it in the clinic because oftentimes they would rather go to a retail pharmacy where they could immediately use their insurance instead of providing money out of pocket for that.
Just to clarify questions about parent relationships with students in this field, are parents informed about any specific situation related to their child's mental health issues or concerns that they bring up in the clinic?
I can answer that question. So a hypothetical scenario is a student who's suicidal, for example, or the student is in danger or something like that, definitely we are going to be consulting with the parents and keeping them abreast of any plans. If we need to coordinate care with them, we will be able to do that. Sometimes we see students, for example, who have received already some treatment in their, you know, in their home or their original community. If we need to get in touch with a psychiatrist or some therapist and coordinate some of that care, we will definitely include the parents to make sure that everything is smooth and that we have plans for any contingency. Another scenario is when the referral is made to, let's say, to the ER for a placement within psychiatry. We will talk to the student, we will reach out to the parent, and again, make sure that they're included in the loop.
Thank you. For Malcolm, does the Resolution Center provide classes to undergraduate students during orientation or at other times to learn some conflict resolution skills?
We are part of orientation. We try and do both during orientation, cover the conduct, making them aware of the student code of conduct, but also we touch on conflict resolution training. We also provide training in partnership with UMEC and other departments where we are actually giving specific training on conflict resolution. We also provide one-on-one conflict coaching that students can access if they want a more detailed and more in-depth kind of training. But yes, we do provide conflict resolution training.
Thank you. We have a question about counseling services. Are these in person, on Zoom? What are the different media that they are able to take place in?
Yes. During COVID and following COVID, we got all of our staff trained on how to use Zoom to make that counseling and psychological service available. And the outcomes were actually very, very positive. And then gradually we have resumed to make our services face-to-face here at the clinic. And that's actually the preference of students, to be able to come here and then for us to be able to observe the students, to be able to interact with them directly. And so if there is a request for some Zoom sessions, for some extraordinary circumstance, let's say the student is traveling or the student is back in their community of origin and so forth, we can definitely consult with the student and meet with the student and provide some of those services.
Thank you. Just one last call for questions. All right, thank you. I want to say thank you to the presenters who were able to come today. Thank you for presenting. Thank you to all those who came and were able to view this webinar. This webinar will be posted to the Parent and Family Experience Communications portal where you will be able to access it. Please feel free, and we encourage you to share this with your students because they will be the ones who will be accessing a lot of these resources. And yeah, thank you for attending this webinar.
Thank you.